Hello, everybody. My name is Regina Asker Williams, and you are once again welcome to Saturday Online Clinic. It is a pleasure to have you. We have to do this on Instagram because somehow Facebook removed the interview, double screen interview on their site. So we're tired of having our doctors only voiceovers. So we are on Instagram to bring in our nurses and doctors to talk to you. It is a pleasure to have you with us. Today we're still on the matter of COVID-19, okay? We're going to talk about the symptoms of COVID-19, the symptoms and how they affect you on different days from day 1 to day 8, and how you should take care of yourself if you notice those symptoms. I will be talking today with an ER nurse, Karen Davis. Karen, we're coming to you in a minute, so be sure to click or to accept our invitation, okay? So, do we have Karen? Can I go on? Okay. So some worldwide statistics of COVID-19 include the fact that there's 1.7 million cases of COVID-19 the world over. And it's not all doom and gloom because 389,651 people have recovered from COVID, and there have been 104,800 deaths. Okay? In New York City, we have confirmed cases of 94,409, and this has been New York has been the epicenter of COVID-19 in America. And in New York, about 19,000 people have recovered. Unfortunately, the death toll has risen to 7,067. And as I speak, it might still be rising. I would like to go through the updates on COVID-19, what people need to do to take care of themselves. And particularly, I want to talk about the healthcare provider point of view, okay? The healthcare provider point of view, what we do in the hospital when you come to us, all right? So do I have Miss Davis, our ER nurse? No? Okay, so call her on the phone. We'll do a voice interview. All right, so still on COVID. In New York City, we have like 42,000 practicing nurses, okay? All nurses are on deck. All hands are on deck to take care of COVID-19 patients. So we are doing our best to, hello, Karen?
Hey.
I'm so happy we're able to get you. I was beginning to flop, wondering if I'll be able to get you online.
No,
Welcome to Saturday Online Clinic.
Oh, hi, welcome. I'm happy to be here.
Thank you for joining us. So we were talking about COVID deaths and some COVID statistics, and today we're going to talk about what we see on the front lines in the hospital, what we see or notice on the patients and how we take care of them. There are 42,000 nurses in New York on the front lines working on patients, and we want to say a big thank you to all the healthcare practitioners, the nurses, the doctors, who are all the true heroes of this scourge, okay? And Karen, you would be one of them working in the ER. You're the first people to receive the COVID patients. So in talking to you today, I would like to ask you, what do you do when you receive a COVID patient? What do you look out for, and what have you seen so far? Before you answer that, tell us about yourself and your work as a nurse, what you do, as an ER nurse. Go ahead, please.
Oh, hi. Hello, everyone. My name is Karen Davis. I'm a registered nurse here in New York City, and I do work in a New York City hospital as a emergency nurse.
Yes.
So what we have seen basically is what most people complain about as their symptoms. You know, people are coming in with mild to severe shortness of breath. They've been having fevers for a while, chills, and headaches, back pain, muscle pain. And so we get from minor symptoms to people coming in in ambulances where, you know, they can't catch their breath, they can't speak a full sentence, they are oxygenation is very low. And
Yes.
so based on how the patient presents is how we would intervene at each and every different patient is different. So
All right, before we go any further, each and every patient is different. How do you protect yourself? Because you can't just go out there and receive a COVID patient. What do you do to take care of yourself and protect yourself before you receive a patient?
okay, so I know everybody's been hearing about PPEs. So PPEs is personal protective equipment that we as nurses wear. We've been wearing it for, you know, as long as you are a healthcare practitioner. There are protocols in place for when we have contagious illnesses. This is the gear that we usually use. Now, because of this widespread virus and disease, it's become heightened, and everybody is more so aware of PPE. So, in order to protect ourselves against this virus,
Mhm.
we have in the COVID area where, first of all, we most of the hospitals now are all negative pressure, um, you know, throughout.
That's up to suck all the air out, right?
Right, because of the disease. And then we wear the N95 mask, which I know people have heard about it on the news. Yes, Regina is holding it up. So the N95 mask with special filters and stuff in place to help to protect the virus from coming in to
Yeah.
through you inhaling it in through your to your respiratory system. So we do
Yes.
wear the N95 mask, and also we wear protective eye shields, which
Yes.
is to prevent also if someone should cough on you, or you know, the droplets from kind of like coming at you in your eyes or your face. So we do wear that to
Your
protect.
eyes. You said your eyes. So if
Yes.
the coughing is into your eyes, it can absorb, your membranes can
Yeah,
absorb.
remember, because it also is part, like they say, wash your hands so you don't touch your eyes and your face, because it can, you know, it can spread. So you touch
Yes.
it into your eyes or your face, your cheeks, whatever, it can somehow, you know, make its way into your respiratory system, which
Yes.
is where where most of the compromise is that we're seeing, as
And
Regina
your hair.
Williams said. And in the hair too, because they're saying it lives in inanimate, you know, it lives on surfaces for from 3 to 24 hours. It's
Yes.
unclear as to how long this thing can actually survive outside
Mhm.
on a host. So we've been wearing protective hair covering, and also we have protective gowns. So if we come into contact, so we're doing droplet, we're doing airborne, and we're doing contact
Yes.
precaution. So contact precaution, we wear those gowns to prevent our clothing from coming into contact with the virus.
All right. On a personal note, let me ask you: do you take off your scrubs in the hospital before you go home, or you wear your scrubs home? I mean, people have different choices. I come home. I come through the basement. I spray everything down with bleach, take a shower, wash my hands and everything before I go inside the house. What do you do, Karen?
Well, my routine has become very extensive. Prior prior to COVID, I would come home in my scrubs and then just take it off as soon as I get inside my house.
Uh-huh.
Now, with COVID, I do a whole strip down at work. So I bring a change of clothes with me to work,
Yeah.
and I after work I strip down. I use our you know, chlorhexidine wipes or whatever wipes I can find, and I wipe myself down. I wipe my hair. You know, I change into my street clothes, and I change my work shoes,
Mm-hmm.
and
Great.
just kind of wipe everything down, pocketbook, phone, glove, everything, you know,
Yes.
and kind of just bag those up in a plastic bag, tie it up really tight. And
Yes.
so then when I get home, that bag goes straight downstairs into the laundry. And
Yes.
so I try to like prevent cross contamination once I get home. Once I get home, I quickly jump in the shower, take a shower, and I feel like, you know, I've left COVID at the
All right. Now, that's great. Now, a lot of us black women do wear wigs, you know, and I know the COVID can live on your wigs. How do you handle that situation? You
Well,
spray it down, or you wash it, or you shampoo it, or you change it.
Well, funny enough, I've been wearing this braided wig to work. So so
Your protective headgear,
yes,
takes
so
care of that.
I wear the braided hair to work, and then that's like a work hair now.
Yes, great. All right, now Karen, let's go through some of the symptoms that people would notice, and then when I talk about it, you tell me. When I mention a symptom, you tell me what you do in the ER to take care of that situation, because I want to take people through what they would notice, how they would take care of themselves at home, how you would take care of themselves when they, how you would take care of them when they come to the ER. Okay, I need to breathe. All right. In day one, the symptoms people likely notice would be like cold and flu symptoms, right? That
Mm-hmm.
would be like fever, mild throat pain, and the people with weak immune systems will experience like nausea and vomit and some kind of diarrhea. What would you advise they do if they're home with these symptoms on day one?
So cold and flu, it cold and cough and fever at home, you would manage that just like you would manage any other, say it was regular flu season.
Yeah.
Those would be like the symptoms that you would have. So you would try to manage it in the same manner, where you would take a Tylenol to help keep the fever down. You would drink lots of fluid. If you have anything like Robitussin or whatever for cough, or you would try to take those things. And in the meantime, if you have, like you said if a weak immune system, you'd be taking some vitamin C or something to try to boost up your immune system.
Yeah.
And just keep monitoring. You keep monitoring your symptoms, because those are like your typical cold and flu season
Yes.
symptoms.
Now, this is where the kitchen therapy, kitchen table therapies come in
Comment,
also.
right?
Drink
So
your soups,
drink
stay
your soup.
hydrated. You can do steam vaporization, like to clear your sinuses and help with the cough and all that. And in monitoring your symptoms, the most important thing is to keep track of your
Your
temperature.
temperature, right? So you
Take your
want to make sure your temperature is not, escalating. You're doing round the clock monitoring. If you're taking a Tylenol, every 6 hours, or if you're taking ibuprofen, depending on which one you're taking, or if you're doing like cold compresses, taking a cold shower, in between things, to make sure that the temperature doesn't escalate and get out of control.
Yes. Okay. So a word about the Tylenol. I mean, they have said that ibuprofen is not a good thing to take if you suspect that you have COVID. But then again, we don't know. People are arguing for, people are arguing against. But um, let's stay on the safe side. A word about Tylenol. How much should you take or not take
Well,
it?
the Tylenol, it all depends on the body weight, but a regular average dose we would give is like 650 of Tylenol.
Yes.
Then again, it all depends on the person's body weight, but a regular dose would be like 650
Yes.
of
I should
Tylenol.
not pass a certain amount, like 4,000 grams a day.
4,000 grams in 24 hours.
Yes. Okay. Now, after that, that's day 1 to 3. You'll be noticing flu-like symptoms like mild headaches, temperatures, fevers, and things like that, diarrhea. Now, on day 4, okay, your throat pain will worsen. Your sore throat will worsen. You'll not be able to swallow or drink easily. The mild diarrhea would continue, and like we said, you continue to monitor your temperature, continue to stay hydrated, continue to, you know, do whatever you do if you have the flu. The kitchen table therapies will work here. On day 5, it is said that you would have intense pain while eating. The body pains get worse. The joint pains. Now, this is not just it's not just ordinary body pain. You feel like you've been hit by a truck. Every time you move, especially, the pain goes into the fingers. Um, what do you suggest here, Karen? Just continue to monitor?
Well, for the body pain and stuff, there's not much you can do. You just have to keep taking medicate the pain medications. If you have
Yes,
any kind of mild pain medications, you can take those. And
yes.
you know, you can, like, you're still using your home remedy, heat
Mm-hmm.
packs,
Mm-hmm.
to help with the pain, and you know, like just home stuff, because there's really not much you can do to mitigate the body pain in terms
Yes.
of coming into the hospital for that,
And
because
at each and at each stage, we healthcare practitioners know what is happening. We know that the body is reacting to the invasion of the virus and trying to compensate and attack the virus. And the side effect of this battle going on in our bodies is all the symptoms we are feeling. And then the patient comes to the hospital because they are having excessive cough, high fevers they can't control, body aches they can't control, and especially difficulty breathing. People, if you have asthma and then you notice the symptoms and you come to a point where you have difficulty breathing, you must immediately come to the hospital. And before you come to the hospital or before you call the ambulance, you should let them know that you suspect that you do have the COVID, that you've been exposed to the COVID. So the people coming to you would protect themselves and the people in the hospital would protect themselves. But any which way, whether you call or not, we are on red alert. You know, immediately we get that call that somebody is coming in, everybody's treated as if they have COVID-19. Now, Karen, when a patient arrives at your ER, at your emergency room, suspected of having COVID-19, take us through what you do when you receive them.
so patients that come in, regardless of whether they're positive or, you know, just a suspected, you treat them as if, you know. So we would do isolation, where we're all on isolation precaution.
Yes.
You want to, you know, make sure you assess their oxygenation status, see,
Yes.
you know, how they're oxygenating, if they're complaining of
Yes.
difficulty breathing. That's something that's important. If so, then you put them on oxygen. If they need supplemental oxygen, you would
Yes.
put them on oxygen to help with the breathing. And then, you know, you're going to work your way through whether diagnostic testing to see, you know, what exactly is going on, and if so, what if they're positive, then
Yes.
what is the next step. So pretty much the imminent thing is the oxygenation. You want to make sure
Yes.
that, you know, they don't become hypoxic, and so you want to supplement oxygen as best you can.
All right. And then you send them up to the unit to us.
Yeah,
Okay.
you work them up. So you would do a blood panel. You know, you're gonna draw
Yes.
some blood. You're gonna swab them to see, to make to for the COVID symptoms. You're going to, you know, I guess, address their respiratory status, and if they're requiring admission, then they would be admitted and sent to a unit for further management. Yes.
Okay. So let's talk about the treatment protocol. When we receive patients in the hospital, now when I talk about treatment protocol, I'm not advising anybody to rush out there and self-medicate, but information is knowledge.
Mhm.
What we do in terms of a treatment protocol is we're using the hydroxychloroquine, right? We're using the antibiotics, we're using zinc and vitamin C. Sometimes we use methylprednisolone, the steroid, to calm the lungs, right? This has been a treatment protocol, but in recent times, somebody has suggested that we got it all wrong when we got to the point of sending the patients to the CCU. You know, sometimes you do all these things and the patient still does not recover. You put them on a high flow oxygen and the patient still does not, is still not able to saturate adequately. So the doctors call and decide to send them to ICU. And when they get there, they put on the ventilators. There is a school of thought that thinks that putting a patient on the ventilator does more harm than good. They suggest that COVID infection is more of like, the body being starved of oxygen. So they suggest that instead of putting them on ventilators, we should like consider giving a blood transfusion from a person who has recovered from the COVID and who has built up antibodies to the COVID. What do you feel about that suggestion? How do you see
Well,
it?
I've been reading articles about that too, and theoretically, I think, you know, it makes sense that
Yes,
if they're saying that that is what's happening, where the hemoglobin is not really carrying oxygen to the
yes,
important organs that it needs to that needs oxygen to sustain life, then if someone has antibodies that can help to fight off this virus, then that would be a necessary part of the treatment protocol. Faith is something that you can't see; it's just something you believe. So in this instance, you have to like tap into that faith that, you know, this